Ashland MobileMed is a new medical practice in Ashland County that I do house calls and telemedicine. So kind of going back to old school medicine, where instead of going to an office, I come out to the homes and see patients for their needs there. I have actually been working in Ashland County in the medical profession since 2002. And just seeing that there was a big need. There was a lot of patients that kind of fall through the cracks who, whether it's insurance and cost is the problem, or mobility and getting to the office, or there was just a lot of patients who didn't get good care because they didn't fit the typical healthcare model. I will see patients anywhere within Ashland County, so even down south of Loudonville, all the way up to Sullivan. I do live in the northern part of Ashland County, so we're even talking about kind of expanding services even a little bit outside of Ashland County because we have a large Amish population a little bit north of Ashland County, so to be able to kind of service the rural community that doesn't have much healthcare in that area also. I do not take any insurance. I'm actually completely opted out of Medicare and Medicaid, so I don't take any type of insurance, commercial or federal insurance. It definitely makes things a bit easier on my end because the insurance companies are notorious for requiring a lot of prior auths or kind of stopping care. So I have found a lot of different resources within the community, like labs that are really inexpensive. I can get an entire panel of labs done for $100 cash price. So I found a company that can come out and do X-ray, EKG, and ultrasound in the house for really reasonable prices. So just partnering with other places too to find out all these cash prices, plus my visits are cash price, and just keeping that overall cost down for the patient, which is huge for people who have really high deductible plans. I mean, it's not unusual in today's world to have a family plan that has a $10,000 or $15,000 deductible. Most families who are relatively healthy are never going to meet that deductible. So then everything out of pocket until they meet that deductible can get expensive quick. So kind of trying to offer a service to those patients where I can go out and offer good care to them, and they know that it's not going to completely break the bank, and they know exactly what the cost is up front, which I feel is huge in healthcare. We live in an era where, you can go to the hospital and you have absolutely no idea what type of bill you're going to get. And this is very transparent. You know exactly what you're going to be billed, when I'm stepping foot in the house. So I think that makes a huge difference. And it's just, there's a lot of uninsured patients in this area. So just having a more cost-effective healthcare option, I think, is a big deal for people who don't have health insurance. So I can do chronic medication, I can do preventative care, a lot of education on different health things, physicals, wellness exams, sports physicals. I'm certified to do Department of Transportation physicals. I go to a lot of the schools and do bus driver physicals. Minor urgent care stuff, so illnesses, injuries, not if you need something sewed back on, that's an ER visit, but you twist your ankle or you've got a bad sinus infection, I can actually come out and do flu, COVID, and strep testing at the time of the visit. The goal is here within the next month to be able to offer lab testing in the house so that I can go right out and draw labs at the time of the visit also. I have through the Board of Pharmacy, a dispensing license, so I can take meds with me to the visit. So if I go out and I think you have strep throat, I can take the meds that I could potentially need with me, and I can dispense those right at the time of the visit so you don't have to go to the pharmacy. Ear flushes, toenail clippings. I can do steroid injections Kenalog injections in shoulders and knees. Weight loss with the compounded medications, Semaglutide, which is the equivalent of Ozempic or Wegovy, which has been life-changing for a lot of people. So that's been helping with a lot of different health issues. I'm actually in the process of going through some education stuff to potentially be offering some hormone replacement therapy in the county also. So women's health and men's health, testosterone replacement therapy, estrogen replacement therapy. So I'm in the works of starting that also. I love to educate patients, and I feel that is a huge benefit on managing your own healthcare. We aren't just here to be hey, do this, this, and this. patients have better outcomes if they're more engaged in their own health. And the only way they're going to be more engaged is if they feel like they are a participant in that plan of care and they understand all of it. So to be able to sit down and spend the time to explain the disease process, talk about the medications, educate them on things that they can do to kind of help themselves and to better their own health. My schedule is not set like, you know, you have 15 minutes with this visit and 20 minutes with this visit. I typically, for a house call, schedule an hour so that I make sure I have enough time to go out and address whatever needs to be addressed. So, you know, a lot of times you might go to a doctor's office and you only go once or twice a year and you have 10 different problems that you want addressed. Well, a lot of times there's not enough time for all of those things to be addressed in a traditional healthcare setting. With me being able to schedule an hour for a visit, I'm able to go out and address whatever needs taken care of. So, you know, if you have 10 different problems that need addressed, I can go out and take care of all of them at one visit. Ashland MobileMed is just me as the provider, and then I have an MA, Connie Daniels, and she pretty much does a lot of the administrative stuff. She's answering the phones, answering messages, so we can get patients scheduled usually within 24 hours, a lot of times the same day. I now actually have the option to self-schedule on the website, so people can find out all the information on the website, ashlandmobilemed.com, and they can get on and they can schedule their visits.